Once upon a time in a city called Greenville was a local hospital. It was filled with great staff, from administration to the nurses, radiographers, and to the doctors. They all worked together to perform the best care for the patient. In the radiology department, there was a new team member named Candy. She was a recent graduate student who landed a job right after receiving her state license. One day, Candy decided to take on a case for an upper gastrointestinal tract procedure, also called an upper GI, and a small bowel series in the fluoro room.
I have Aviana Jenkins in room 1 for you.
Thank you. I will be right there. Good morning. My name is Candy, and I will be assisting in your procedure today. May I have your first and last name, please?
Ivana Jenkins.
And your date of birth?
4/26/1991.
Candy checked her requisition as well as the patient's wristband before proceeding.
When was your last menstrual cycle, and is there any chance you might be pregnant?
I think it was about 2 weeks ago, and no way.
So what brings you in today? It says here that you have been vomiting.
Yes, for 5 days straight. I've been drinking soup this past week. These last 2 days, everything I ate will come back up.
Okay, so we are going to perform an upper GI examination first, and then we'll do a small bowel series. We will be giving you barium to drink. It is a little bitter. Try drinking it slowly so the doctor can see where the problem is. If you feel like you're about to vomit, I will give you a bag. The doctor will be coming in shortly to take a few pictures to see how well you digest and what might be causing you to vomit. So first, we are going to slide you on our examining table and take our scalp shot.
With the help of Jennifer, the experienced tech, the two radiographers position a sliding board to transfer the patient onto the exam table. Suddenly, another tech rushes into the room to alert Jennifer that she needs her help right away. There's an emergency. Jennifer apologizes and tells them both she'll be right back. Candy is content to stay with the patient, but as 1 minute rolls onto 10, Candy is afraid the patient's patience will wear out. Suddenly, it was as if time had frozen still, and Candy saw a fairy appear out of thin air. The fairy looked directly at Candy and said,
"Hello, my dear. I'm your protective fairy godmother, PFG for short. I'm here to help you, since you've just started this job and may need a little bit extra twinkle dust."
Without warning, the fairy lifts the patient and the board underneath onto the exam table. Candy helps with the patient's feet, thinking that this all must be a dream. And just as quickly as the fairy appeared, she disappeared. Jennifer came back into the room, glancing at the stretcher and then to the table with a very confused look on her face.
"Did you just move that patient all by yourself?"
Jennifer looked at Candy, expecting an answer, so Candy just replied,
Yeah, I guess I have more muscle than I thought.
Jennifer looked at her suspiciously and advised her to get the patient situated and take the scout image. Candy did so, and as she was walking out of the room to find the radiologist, time was frozen once again, and the fairy godmother appeared.
"Don't forget your lead aprons for you and the doc to protect you both from the radiation. Using a lead shield greatly reduces your occupational dose."
Just as the PFG was finishing up her reminder, an evil fairy named Scatterjack materialized.
"Oh no, that's Scatterjack. He'll take away from your image and increase your patient dose. Keep away, Scatterjack."
But Candy was too slow to catch him before he swiped the lead apron from her and flew away, disappearing and laughing evilly. PFG quickly produced another apron for Candy.
"Here you go, my dear. Be on the lookout for that one. He enjoys messing up our images so that we have to repeat them."
The PFG was off again, leaving Candy with the lead aprons in hand. She walked across the hall to let the radiologist know that they were ready for him. Candy got the room all set up for the exam, the supplies needed for the exam on a table nearby, the monitor screen for the radiologist all ready, and put the lead curtains into place on the fluoro machine. Candy walked over to the patient to explain to her about the steps of the procedure and to ask her how she was doing.
I'm doing alright. I'm just tired of feeling so unwell. I'm really hoping this test will help answer some questions of mine.
Candy reassured her that the doctor would try his best to discover what was going on. She patted the patient's hand and told her that she would be right back to get the radiologist. As Candy was about to walk out of the room, time froze still and Scatterjack came back again. He flew over to the fluoro machine and knocked the lead curtains out of place, and the heavy protective gear fell to the floor. Abruptly, the PFG flew into the room and started chasing Scatterjack around the room.
"Keep away, Scatterjack. Keep away."
The PFG chased Scatterjack out of the room just as Candy picked up the lead curtain and put it back into place, in plenty of time before Dr. V entered the room.
Hello, Mrs. Jenkins. They call me Dr. Vonkovich. I'll be performing this exam to try and find out what's going on today. Has anyone explained to you what we're doing? Yes, she has, multiple times. Okay, good. By drinking this contrast, we will see if there's any obstruction or leakage.
Candy angled the exam table and stood next to the patient, waiting for the doctor's approval to let the patient start drinking the contrast.
Go ahead.
While Aviana drank the contrast, the doctor floored the patient from the esophagus to the stomach and watched the stomach filled with contrast. The PFG appeared once again to remind Candy about the benefits of distance.
Remember to take just 2 steps back. It reduces your exposure from 300 milliroentgens an hour to about 5 milliroentgens an hour.
Just as Candy was about to take 2 steps back, Scatterjack appeared to place immobilization tape around Candy's legs so that she couldn't move back.
Stay away, Scatterjack, stay away.
The PFG chased Scatterjack out of the room once again, and as she did that, the tape fell off of Candy's legs and she was able to take 2 steps back.
That was a close one.
During that time, Candy was very aware of her surroundings. She wanted to make sure that no fairy came in to disturb this test and assisted the doctor in the procedure. She kept her eyes on the 5-minute floral alarm to make sure they maintain a good floral time that will allow them to have a good, low radiation dose.
Mrs. Jenkins, everything looks good. Next, they're going to take a few pictures every 15 to 30 minutes to see how well you digest it from your stomach to your small intestines.
As the radiologist left the room, Candy explained the next portion of the exam. Just as she was leaving the room, she heard the beep, beep, beep of her alarm clock going off. Her eyes fluttered open and she could see the ceiling fan that was attached to her bedroom ceiling spinning around. It was then she realized 2 things. First was that she dreamt the entire scenario. Second was that she still had to complete her first day as an X-ray tech. Candy sighed, said a prayer, and began her day hoping that no whimsical creatures made any sort of appearances.
The end.
Yay.